Hello, my name is Teena Dotson and I'm a physician assistant at La Esperanza at the Lakeview Clinic. And today I'm going to talk about obesity. Obesity is a complex disease involving excess amount of body fat. And it is diagnosed by using something called the body mass index, or the BMI. This is a calculation based on your height and weight. Now, it does not take into account percent body fat. So if you're a really big athlete and have a lot of muscle, it's probably not going to be a useful tool for you. It is a general guide. Speaking of, the BMI results of 18.5 to 24.9 are normal. The results between 25 and 29.9 are considered overweight. 30 and over are considered obese. So what are the causes of obesity? So there are some genetic, behavioral, metabolic, and hormonal factors that may affect your body weight, but it basically happens when you take in more calories than you burn through regular normal activities or physical exercise. So your body stores these excess calories as fat. Unfortunately, most Americans' diets are too high in calories, often from fast foods and high-calorie drinks like juices, sodas, sweetened caffeinated beverages. And people who have obesity might eat more calories before feeling full. They also might feel hungrier sooner, and they eat more due to stress and anxiety. So what puts you at risk for developing obesity? There's several risk factors, but one of them is family inheritance. Obesity tends to run in families, and it's not just because of the genes that you inherit, but family members also tend to share the same eating habits and activity level. But the big ones are lifestyle choices. An unhealthy diet. A diet that's high in calories, lacking in fruits and vegetables, full of fast food, high-calorie beverages, and oversized portions. There's also liquid calories. People can drink many calories without feeling full, especially calories from alcohol or other high-calorie beverages such as sugared soft drinks. And then there's inactivity. If you have a sedentary lifestyle, you can easily take in more calories every day than you burn through exercise and daily activities. Now, there are certain diseases and medications that can contribute to obesity, and I encourage you to talk to your healthcare provider about those. There are also social and economic factors that are linked to obesity. It's hard to avoid obesity if you don't have safe places to walk or exercise, or if you've never been taught how to cook healthy, or if you don't have access to healthier foods. In addition, the people that you spend the most time with can affect your weight. You are more likely to develop obesity if you have friends or relatives with obesity. Another risk factor is age. Obesity can occur at every age, even in children. But as you age, you have hormonal changes, and most people's activity level decreases. And the amount of muscle that your body tends to hold on to as you age decreases as well. That can lead to a decrease in metabolism. So your caloric needs decrease. And so it makes it difficult to lose weight or difficult to keep those extra weights from coming on. Other risk factors in general include pregnancy, quitting smoking, lack of sleep, stress, gut bacteria, and previous attempts to lose weight. But even if you have one or more of those risk factors, it doesn't mean you have to have obesity. You have more power than you think, and you can counteract most risk factors through diet, physical activity, exercises, and behavioral changes. So why do we care about obesity? I mean, what's the big deal? The reason we worry so much about obesity is because of the complications that are associated with obesity. Obesity can make you more likely to have high blood pressure or cholesterol problems, which increases your risk for heart disease and strokes. Obesity can affect the way that your body uses insulin to control blood sugar levels, and that can increase your risk for development of type 2 diabetes. Obesity may increase your risk of cancers of the uterus, cervix, endometrium, ovary, breast, colon, rectum, esophagus, liver, gallbladder, pancreas, kidney, and prostate. It can also make you more likely to develop heartburn, gallbladder disease, and liver problems. Obesity can cause infertility and irregular menstrual cycles in women. It can also cause erectile dysfunction in men. It can lead to sleep problems and a condition called sleep apnea. It also increases your risk for developing osteoarthritis in weight-bearing joints like your back, hips, and knees. Most recently, obesity has been shown to increase in developing severe symptoms if you become infected with COVID-19. It also can affect your quality of life. You may not be able to do things that you previously did, like enjoyable activities, which may make you avoid public places or even face some discrimination. Those things can lead to depression, sexual problems, disability, shame and guilt, social isolation, and lower work achievement. So how do you avoid being obese, or how do you treat it? Treatment and prevention are the same. As I stated earlier, people have more power than they realize to treat or prevent obesity. And here are some options. Exercise regularly. You need to get about 150 to 300 minutes of moderate intensity activity a week to prevent weight gain or lose weight. And you can start by simply counting your steps. Most smartphones these days have ways to track your steps. You can start by using 5,000 steps a day as a goal and slowly increase to 10,000 steps a day. Another thing is developing a healthy food plan. Focus on low-calorie foods, nutrient-rich foods like fruits, vegetables, and whole grains. Avoid saturated fats. Limit sweets and alcohol. Eat 3 regular meals a day with limited snacking. You can still enjoy a small amount of high-fat and high-calorie foods as infrequent treats, but you should be sure to choose foods that are good for you most of the time. Try to avoid food traps that cause you to overeat. Identify situations that lead to out-of-control eating. The best way is to keep a food journal. Write down what you eat, how much you eat, when you eat, how you're feeling, and how hungry you are. In time, you should be able to develop some patterns and see there are some certain situations that you can plan to avoid. Monitor your weight regularly. People who weigh themselves at least once a week are more successful in keeping excess pounds off. Plus, you can see if any of your goals that you have set are working. And you can also monitor slight increases in weight before it becomes a big problem. Be consistent. Sticking to your healthy weight plan during the week, on the weekends, on vacation, and on holidays, as much as possible, increases your chance for long-term success. So when should you seek medical attention? If you're concerned about weight-related health problems, ask your provider about obesity management. Together, you can evaluate your health risks and discuss your weight loss options. The good news is that even modest weight loss can improve or prevent health problems associated with obesity. Dietary changes, increase in physical activity, and behavioral changes can help you lose weight. But there are some prescription medications and weight loss procedures that are additional options for obesity. I hope this information was useful for you, and I thank you for your time. If you would like to schedule an appointment, please call 325-658-5339.